Facial appearance. Cheekbones or cheek bulges. For far too long, we've thought that the way you looked, your bone structure and facial shape has been purely genetic. It was that God-given, that genetic hand of cards that you were given that determined how you would end up looking. But the evidence is building up to strongly suggest that this isn't true. We can look at the skulls of our ancestors. For thousands upon thousands of years, we always had great bone structure. It's only a recent thing for people not to have great bone structure. Now what's going wrong? How can we see that, and can we do anything about it? Well, when I look at a face, I will try and judge from the surface signs and features, where the position of the tongue is, which is specifically related to the cheekbones or the buccinators, the cheek bulges. If the tongue rests between the teeth, then as you swallow, you either have to bite on the tongue or use your buccinator muscle, the cheek muscle. That muscle that was designed for when you were an infant to suckle. That's a muscle, and the more you use it, the bigger it becomes, like any muscle, by a huge margin. Now, if your tongue's between your teeth and you're not biting on it, you'll build up cheek bulges. Lots of people just think they have a chubby face. There's no fat there. There's a little bit of buccal, they have the buccal pad of fat, but that's not increased in size. It's about the same in most people, roughly. But it's their tongue going sideways. Because the tongue goes sideways, it needs to be reciprocated. Just try, without biting your tongue, put your tongue between your teeth and try and swallow. You'll need to use the cheeks. But if you use the cheeks all the time, they'll become bigger, like any muscle would become. But, of course, this area of your face here, this is supported by your tongue being up on the roof of your mouth. So the anterior section, the front section of your cheekbones, that's determined by your tongue being up on your palate, which will broaden that upper arch and support your front anterior cheekbone. So when I look at a face, I'm seeing where the position of the tongue is at rest, so for most of the time. And if that tongue is up on the roof of the mouth, I'm going to see an anterior cheekbone. And if that tongue is down between the teeth, I'm going to see bulges on the cheeks. About slightly more than half the time, because some people will bite on their tongue and that will get a slightly different effect. But as a general rule, it's a quick assessment. So I'm trying to assess as many people's faces, and a good way of doing that to test me, to make me think, is whenever I'm on the tube, whenever I'm on the train, whenever I'm out on the street, as people walk by, I'm assessing their faces. I'm looking at the strength of the muscles and the position of the tongue. And that position of the tongue, that's going to determine the likelihood of you getting cheek bulges or cheekbones. And that's determined on your posture predominantly, but also your function.